People are recognizing that we've made a lot of advances. We've achieved a lot in confronting the HIV epidemic, but also they recognize that there's a lot of work ahead of us, and getting to the next stage, being able to really control this epidemic will require a lot of attention to quality.
Where we are now with the global AIDS response, where we are looking towards 2015, where we are setting very ambitious targets, the 3 90s, 90% reduction in incidence, 90% reduction in deaths, 90% reduction of discrimination. There is no doubt that we will not achieve these ambitious targets, where we will not be able to move towards ending the AIDS epidemic unless we move from the paradigm where we exclusively look or very strongly only look on coverage, unless we also really focus on the improvement of quality.
One of the reasons we're meeting today is because quality is really become kind of a buzzword in our programs, and it means a lot of different things to a lot of people. Quality improvement is basically the black box between implementation and success.
QI is just ensuring that you do what you have to do, but do it well and be able to do it over and over again while instituting some changes that will make you even do it better.
We know the interventions that work, but are we delivering these interventions in a way that makes them optimal to have the desired impact that we need?
So it's about making care better, and it's about giving the right care to the right person at the right time every time. And I think that's a very good, simple way of putting it.
So the first thing is to convince people, to convince policymakers, and to convince the people that are working, the service providers themselves that are working on the ground, what quality improvement is. And they have to differentiate it between quality assurance and quality improvement.
The old way, or the sort of earlier ways that we thought about this, which was really looking at targets and looking at performance, I think tend to blur somewhat where there are specific challenges in steps in the continuum and where really targeted improvements could make a big difference.
And where I think we need to focus is to define simple methodologies for delivering these services, but also monitoring these services so that we have a feedback loop to what we're trying to do in the system.
What I think could be very important is having the data available, because when the data is available at the community level or at the health center level or at the district hospital, in general, healthcare workers want to do a good job. And when they can see how they're doing compared to others and the data is available to them on a routine basis so they can make mid-course corrections so it becomes a constant. We often talk about quality improvement, it's like it's a one-time thing. It's a constant, ongoing approach to healthcare.
It motivates them, the health workers, at the service delivery point. We always think that motivation is about money, but from my experience, I've seen nurses who are so motivated just because they've looked at their data.
I think it's about institutionalization and making ministries of health understand why it's important and why quality will give them a better bang for their buck, better efficiencies, better outcome, better impact.
We at Ministry of Health, when we do our planning, we must make sure that QI is in the center of our planning. Previously, we never used to think about it. So in all the activities that we do, we plan under whatever intervention area of HIV, we must make sure that we factor in QI or quality activities.
The positive aspect that I see is there's really a great convergence in thinking in countries, but also by the major partners, implementation partners. I hear PEPFAR talking about this, I hear Global Fund talking about this. Our work at WHO, we really want to enforce the notion of quality in our work and throughout our work by defining the quality indicators and some of the measurement methods that countries could use. And if we all work together, I think we should be able to really increase quality and efficiency and ultimately get to where we want to be.